Hello, hello, hello. How are you doing? I trust you're well, and thank you for joining us once again on Adolescent Youth SRHR digital platform, where we discuss matters sexual reproductive health among young people. So today on the studio, we are joined by Seif Jira from Dio, and he's going to share with us more about the work that they are doing. So welcome to the studio, Faith. Hello, greetings.
Hello, hello. Good
How are
afternoon.
you doing?
I'm fine.
All right.
Uh,
Kindly introduce yourself and share more about what DIO stands for, even the initials themselves.
okay. Thank you for this opportunity. This is Seif Jira, and I work for Dream Achievers Youth Organization. And DIO is Dream Achievers Youth Organization, and it's a community-based organization that's based in Mombasa. We are youth-led, youth-focused, and we have been implementing programs since 2005. We started the organization as a performing artist in 2005, but due to demand of the community in 2009, we decided to change the status of organization and register this organization as a community-based organization. And we are focusing on SRHR. SRHR is one of the areas that our organization is focusing. And we are implementing program in 5 countries, that is Nairobi, Mombasa, Kisumu, Kwale, and also Kilifi. So that is a brief about the organization and the area that the organization is focusing on. Thank you.
You're welcome. So which projects have you implemented as DIO and are currently implementing as DIO?
In
With
general, we have
regard to
been
SRHR,
implementing. Okay. We have been implementing the number of projects, and currently, I can say, in general, we have implementing more than 50 projects. But currently, we are implementing 4 projects. That is SRHR Youth Advocacy Mombasa. That is the first project that I'll talk about, which is as a project that is being funded by HIVO Southern Africa that has the aim of reducing the teenage pregnancy in a specific area in Mombasa called Ziwalangombe. So what we are doing to this project, we are trying to make sure young people or adolescents, girls and men, young men, they are getting
hello, Safe. Seems there's a network issue, but
service in terms of issue. We are working in the so if we are working with schools, and we are working in 4 schools. That is Zwalangombe Primary School. We also working at a school called Fiatauni. Apart from Fiatauni, we also working in a school called uh, Maweni Secondary School. And what we are doing, we are using a concept called Dance for Life. The concept is like a curriculum that we are following in, and the curriculum has like 10 sessions. One of the sessions is reproductive health. In this curriculum is focusing on reproductive health, which we are talking about sexuality, life skills. Apart from life skills, we're also talking about drug and substance abuse. And within this school, we have come up with the clubs, which we call this club Skills for Life clubs. The Skills for Life clubs is the club that young people would meet and discuss issues that are affecting adolescents and young people. So this is project number 1, and uh, this area of school based, we also have the community based. The community based, we're working with CHBs, which we have set up our youth-friendly center at Zolangombe facility, whereby young people come there and access services. If you are an adolescent person between the age of maybe 16 to 24, if you come to our facility, you are given first priority because the facility acknowledges that young people must be given priority to access services. We have young people there who they are directing our young people to get services for free, and also are trying to create awareness within the facility and tell the people in charge at the facility level that we give priority to young people. Then project number two, we are implementing another project which is being funded by AMREF, which is called YACT, and our focus to this program is we are focusing on menstrual hygiene management. It's an advocacy program that is being implemented in 2 years' time, and we are at the middle of implementation. Our focus to this program is to make sure we demonstrate the policy that was developed at the national level, and we want all the aspects within this policy being implemented at the county level. We started over identify the groups of young people that we can work together. We form a coalition of 10 youth-led organizations that we are working together. And also moving forward, we are looking forward to we we develop a policy brief for MHM in Kilifi, and we are looking forward to have a writing team so that we can do a MHM policy within the county, because we don't have a MHM policy that count guide at the county level. So we are looking forward to start engaging the county, engaging young people within the county, so that we can develop a policy that is focusing on the specific county, which is Kilifi. That is project two. Then project three that we are implementing in terms of SRHR at Dayo is Silale. Silale is another program that we are implementing in Kilifi, and we have been supported by DSW. DSW is the German Foundation for World Population, and we have been implementing this program for the last 2 years. We are implementing in a consortium of four or three organizations, which we have a Safe Community Initiative, which is based in Kilifi, and also we have Fun Youth Network, which is based in Mombasa, but implementing their program in Kilifi too. So round one, or the phase one of this program, we started with coming up with the innovative. We did a video that tells the story of Kilifi, especially for teenage pregnancy, and focusing on young people accessing family planning services, young people accessing youth-friendly services. So the aim of this program is to make sure Kilifi, as a county, has allocated money to renovate the youth-friendly centers at Kilifi. So we have already harvested some outcomes. One of the outcomes that we have harvested is that the county itself in Kilifi allocated money to renovate for youth-friendly centers, and currently they have already renovated those centers, and we are looking forward to push them so that they can renovate other youth centers. We did also a policy, we did also assessment report, because you can't go to a place where you don't know their problem, you don't know what their priorities. So we went there and did a survey with support from another organization. LBCT was one of the organizations that gives support to come up with the assessment. After having the report on assessment, we make sure the assessment is summarized to a policy brief, and we have a report. Apart from report, we also have a policy brief that talks about the challenges that young people are facing in Kilifi, especially for the youth-friendly centers and services in Kilifi. Then last, we complete another program which we were implementing with a consortium members from Nairobi, a total of 15 organizations, and we are very lucky because the consortium, we are one of the youth-led organizations which we implemented the program and successfully harvest many outcomes in terms of And I can give an example of the outcome that Dio harvested. We created in Mombasa, we come up with one of the outcome we came up with creating TWG for school health. So we created that TWG in Mombasa. Apart from that, Dio also supported development of policy brief that are supporting young people living with disability. We also summarize the adolescent sexual and reproductive health policy to a one-pager. Apart from that, we also summarized and did a policy brief on school health policy. So we have harvested a number of outcomes from this program, and we are looking forward maybe next year or the other phase to come, so that the organization can also implement some other programs within this project. That is all about the project that DIO is implementing. But if you have any question, I can respond to the questions. Thank you.
Oh, you're welcome. So you've mentioned that even with regard to the first project that you shared, that you also engage in improving the facilities,
Yes,
the
yes.
health facilities. Kindly share more about that. Are you improving the health facilities so that they can be youth friendly, or tell us more about that?
About the first project, which is called SRHR Youth Advocacy in Mombasa, being funded by Hivo Southern Africa, we supported one of the facility within Mombasa, which is called Zualangombe Head Facility. What we did to this facility, we came up with having a space and having a desk where young people, if you are accessing this facility, you'll be received by a young person who will help you to get services. So we have a youth desk. The youth desk has a young person who has the information on SRHR, and also this young person is being supported by that in terms of transportation, in terms of lunch. So if you go to this facility, you'll meet this young person, and we have 10 young persons. They are being supported by DIO, and they are going to this facility in rotation basis. If you go Monday, you get a young person, two young persons. Go Tuesday, you get two persons. They are rotating to give information and services to this person. Also, facility personnel within this facility, they have been sensitized and trained on how to give youth-friendly services to young people and adolescents, boys and girls. Thank you.
All right. Thank you. Thank you. Thank you for the information. The other question I'd like to ask is, have you seen an increase in the number of adolescents and youth visiting that particular health facility to seek information and to be advised?
Yeah, first and foremost is that the 10 young people that we are supporting, they have two tasks to do within the facility. One of the tasks is to talk to people at their community level and refer them to the facility. So each and every young person who we are engaging, they have to go and talk to people, convince them and telling them, if you go to this facility, you'll be treated good, because the personnel within the facility have been trained how to give youth-friendly services. So in terms of the number, we have experienced a lot of young people come to this facility and access services because of the mobilization we are doing with our CHVs. If you talk to young people well, the young people understand you, and they will come to the services. But if you don't have a way of engaging young people and convince them to come to the facility, the young people will not access services. So what I can say is that the number of uptake in terms of services, they have been increased within this facility, and young people have been registered, many compared to the other year that we are not in this facility. Thank you.
Thank you. All right. So the other question that I have for you is, Do you work closely with the county government of Mombasa?
Yeah, yes, the DIO we are enjoying the privilege of having good working relationship with the county. We have been implementing program being supported by Mombasa County, especially if you go up there from the chief officer supported the organization. If you go to the director of health supporting the organization. If you go to SRH, adolescent and SRH personnel who works with young people, will tell you that DIO is our partner, and also we have been supporting the partnership meetings, especially the TWG's meeting that has been supporting the county, also the review and quarterly CHMT meeting have been supporting them. So we are well known by the county, and we are enjoying the trust that Mombasa County is giving us. Thank you.
All right. So, viewer, I know you had some initials there. You had CHV. CHV means Community Health Volunteers. You also had
Yes.
TWG. TWG means Technical Working Group. And he
Okay.
also mentioned CHMT. That refers to the County Health Management
Management team.
Team. Yes. All right. So the other question that I have for you is share with us more about your team.
Yeah, DIO is a full-fledged organization and has personnel within the team. DIO is governed by the advisory board of five people with a lot of experience in terms of programming. And this team, we have a chair, we have a board treasurer, we also have the board members within the five team. Then we have
Seems there's a technical issue, but is going to return shortly. Yeah, so while we wait for Safe to come back, you've had the remarkable work that Dio is doing in Mombasa County. You've even heard more about the first project that they have mentioned, where they are working on improving the health facilities, and you can see that they have established a youth-friendly center in Mombasa County. The first time I heard about the youth-friendly center is when I attended the Reproductive Health Network conference that was held in Kilifi County last year, now Watamu. So Seif Jira had gone there to go and present an abstract regarding their youth-friendly facility. And you know very well that young people have been shying off from visiting health centers so that they may receive adolescent or relevant information with regard to their sexual reproductive health. But because of what they did in Mombasa County, having their own facility, it has improved even the uptake of youth utilizing the center so that they may access sexual reproductive health. And you know, like Mombasa County is one of the leading counties with regard to matters teenage pregnancy. All right. So you find there are high rates of teenage pregnancy, and you also find that it's high rates of HIV because of the location. It's in the coastal town. All right. And it's also and there are lots of tourists who visit that particular town, and you find that the adolescents and youth there, they are exposed, all right? They are exposed to different cultures because you find many people from the West visit that particular town, and the world visit that particular town. And if these adolescents they are not taken through relevant sexual reproductive health information, you will find that they may veer off from their path, and that is why you find that Dio is decided that he's going to initiate projects in Mombasa County so that they may reach this key demographic. All right, and I also met Seif Jira again in 2018 because they had been nominated for an award for the Diversity and Inclusion Awards that recognize change makers in the communities. So, and Seif Jira and together with the board member, one of the board members, we met at Safari Park Hotel where we were recognized for the work that we are doing. So just a minute, I'm seeing him texting me. Using the link. All right. Yeah, so I was just communicating to Seif. He's coming back to the studio. All right. Yeah, so yeah, that's the second time that I met Seif at the DR Awards. All right, where we were both being where we were both being awarded with the prizes for the commendable work that we are doing in the community. So let's just give him a minute to join the studio so that because he was just finalizing on even how he's going to share with us how he's engaging with his team. And so viewer, in the meantime, even as you wait for Seif, I'd like to inform you that this particular platform is opening doors for organizations who are specifically working with youth. And you see, like we have following on Instagram, we have following on or I'm trying to yeah, I'd like to call him. Yeah, we have following on Instagram, Twitter, Facebook, and even yes, and even YouTube. And what I'd like to let you know is that the world is watching these videos that we are showcasing, because most recently I got an invite from a certain international organization who told us that they are watching the shows, that the videos that we stream here, and my aim is to ensure that that youth organizations that are implementing projects on the ground, they are known, and their visibility should not only be known at the country level, but also globally. So that's the aim of this particular show, to network youth organizations from across the world so that they may be able to share best practices. So Seif has joined us once again. Hello, Seif.
Hi.
Yeah, before you disappeared, you were sharing with us about your team. Maybe
Yes,
you can
sir.
start again and share with us about your team.
Yeah, I've said that the organization is being led by advisory board of 5 individuals, and I have highlight the individual, which we have a chair, we have also treasurer, and also we have 3 members. And within these 5 able board member, we have a young person who is the age of 22, representing the voice of other young people within the board. Apart from that, we have a secretariat or we have a staffing team of around 7 individuals who supporting the organization in terms of implementing of the program. One of the individuals or the staff is the executive director, who is the Seif Jira. Also, we have another person who is supporting the entire team in terms of programming, is the head of the program called Enos Opio. We also have another personnel who is at the finance department, and she's a lady who she's able to report and also do reports in terms of finance and managing all the money within the organization. Apart from that, we have a specific person who is dealing with reproductive health and rights, which we call him SRHR coordinator, who is also supporting the program in terms of SRHR programming. Apart from that, we have a M&D department where we have a lady who she also supporting in terms of data, doing the success story, doing a lot of work around in data, and also following up at the facility. You'll see her going there to verify the number that have been entered with our CHBs and educator, which they are correct. Apart from that, we also have another lady who is supporting finance in terms of administration work. Apart from that, we have also another young person who is supporting work at the office as an office assistant. So the organization has a team, a full-fledged team of 7 individuals who making sure the objective of the organization or the vision of the organization is going where it's supposed to be. Asante.
All right, all right. So I just have a question. Like, is there maybe a member of your team that you wanted to also maybe join in and maybe share a little bit, or
Maybe I request one guy, but you can give me like 3 minutes so that I
no
can give
problem, no problem. Just
you. Okay.
let them just come there and then they
Gaetano,
can.
1 minute, please. Yeah, well, one of my colleagues who is dealing with SRHR, he will come here, maybe share something with you. So invited here. Yeah, come and say hi and say something on SRHR.
Hello, how are you?
Hello, how are you?
I'm good, Violet. How are you?
I'm well, I'm well. Kindly introduce yourself to the viewer and share with us about, yeah, a little bit about yourself and the work that you do in the organization.
Oh, okay. My name is Gaetano Mugandandalo, and I'm currently the Sexual Productive Health and Rights Project Officer here at the Reproductive Organization. And basically, my work entails overseeing the implementation of all SRHR related, I can say, projects here at the organization. And as the main advocacy officer, I'm also engaged in ensuring that advocacy efforts, are also plugging into the respective county processes that we operate in, and that is Mombasa. I can say also Kilifi, where we are currently operating, and at some point, back in the day, we were also operating in Nairobi. And at the moment, we have projects that majorly are addressing one menstrual hygiene management for Kilifi County. And in this particular project, we are advocating for the domestication of the MHM policy by Kilifi County government. MHM is a very big issue in Kilifi, and it's one of the areas that was identified by youth advocates, the ones that we are working with on this particular project. We also have a project that has been advocating for the establishment and operationalization of youth-friendly centers. This project is also based in Kilifi, and it has been supported by DSW in Kenya. And basically, we've also seen through this project the setting aside of 4 youth-friendly centers by the Kilifi County government for refurbishment. And through this project, again, we've seen a commitment of almost 5.2 million in the KFP supplementary budget that will go into making sure that the youth-friendly centers are also operational. In another project supported by HIVOS called the Sexual Productive Health and Rights Youth Advocacy in Mombasa, it was also looking at the issue of teenage pregnancy, and this particular project had 2 components to it, where we had the school component as well as the community component. So for the school component, we are reaching adolescents and young boys and girls with the SRS information as well as life stage in order to actually capacity build them to make informed decisions that will uh, enable them avoid risky behaviors and situations which eventually will lead to the reduction of teenage pregnancy. And on the side of the community, we've been engaging with community health volunteers. Also, we've been supporting them in terms of making referrals to one of the facilities that we've been supporting called Ziwalangombe. So the referrals were mainly for SRS and family planning services for adolescents and young people, because then again, information is one thing, but access to services and information, correct information and comprehensive services is also another aspect that comes with SRHR related programs. And in another project called the Right Here, Right Now, I was actually involved also in advocating for strengthened implementation of the Kenya School Health Policy. And in the School Health Policy, we are looking at the component on comprehensive human sexuality education. You remember, it's a very contentious issue in our country, which is yet to gain acceptance from a sectional of society. I'm talking about the religious leaders. I'm also talking about some conservative cultural leaders who are still opposed to the implementation of the comprehensive human sexuality in our schools. And apart from that, in this particular project, we've also managed to make summaries of the Kenya School Health Policy, as well as the summary of the Adolescent Sexual Productive Health Policy. And the idea that informed doing all these summaries was simply because we came to understand that also adolescents and young people don't have actually full information on the policy provisions when it comes to matters sexual productive health and rights. And this is because of the lengthy policy documents that we have in place that actually deter young people from engaging with them. So we thought of doing summaries to ease their understanding as well as enable them to be in a position to engage, I can say, effectively with even policymakers when they are addressing the sexual productive health and rights. So in a nutshell, that's what I've been doing here at Dream Achievers Youth Organization. Back to you, Valerie.
All right. Thank you for sharing that information, Gaetano. Yeah, so what challenges have you faced during project implementation?
Well, for this particular time, the COVID-19 situation actually brought about many challenges, which actually entailed not having those public gatherings. Because during our project conceptualization, we had activities that entailed public gatherings. For example, we had an activity which entailed community theater activation in communities where now we are supposed to use theater to pass across SRH related information. And in those particular activities, we're also supposed to have integrated outreaches. So when COVID struck, we had to go back to the drawing table and actually come up with a different strategy in order to attain the same objective. So what we did, we shifted the outreach to an index based on the advice that we were given by the county reproductive health coordinator in Mombasa. So that was one of the, I can say, challenges. The other challenge that we've been facing, especially in project implementation, is the bureaucratic process at our respective ministries, and for example, the Ministry of Education. Remember, there is a protocol that organizations which have school programs need to follow for them to access any school here in Kenya. So the long bureaucratic process has actually affected also project implementation in that it took us very long for us to be able to actually gain the trust of the schools around us to enable us have sessions with their children. And remember, these sessions were just based on the goodwill that we had with the respective heads of schools. Yeah, so that has actually been a struggle. And then the other struggle I can say is the back and push when it comes to also policy implementation. Remember, the government most of the time makes commitments, and if I can take people back, during the ICPD plus 25, the government made 17 commitments, and out of those commitments, there was zero need for family planning. There was also zero maternal deaths, and as well as zero gender-based violence. So these are some of the commitments that the government made. And when it comes to now policy implementation, because for any effective implementation to take place, then there should be a comprehensive policy that provides guidance on how different activities are going to be implemented and also provide indicators for success. So a case in point comes when you see like the Kenya School Health Policy, it provides for the implementation of the comprehensive school health, comprehensive sexuality education. But now, the government, when it comes to implementation, is a little bit reluctant. Up to now, as we're speaking, the curriculum is still being developed, and all those programs that were that were operational, the programs that were addressing CSC in schools were also stopped. So, whereas you find the policy is progressive when it comes to implementation, it's a bit difficult because there's no goodwill and buy-in from some government departments. That is one case in point. Another case in point, you will also look at when it comes to another policy like the reproductive health policy, adolescent sexual productive health policy. You find that it has been in operational for the last 5 years, and this particular year, it was supposed to come under review, where now the gaps that had affected its implementation get to be identified, and then different interventions are also developed to mitigate against those particular gaps. But now you see with COVID-19, I think it took people off guard, and not enough prioritization was made in terms of actually kickstarting processes that will see that the policy also comes under review. The other also challenge is that you find, like the Kenya School Health Policy, up to now, it doesn't have the implementation framework, and it's 2 years down the line. So you can imagine if this is a policy that's supposed to be operational for 5 years, and for the last 2.5 years, the implementation framework is yet to be out. How effective is this policy going to be in the event now that the implementation framework maybe comes after 3 years, or 4 years after the development and launch of the policy document itself? So these are some of the challenges that we in the civil society have been facing and continue to address. And we are also counting on the goodwill of the respective county government. I'm very happy to report that at some point we've been having, good relationship with the respective county government, which has also made our work very easy. But now on the policy part, a lot needs to be done. We no longer need to talk the talk, but as I said at some point last week, we need to run the talk, because time is not on our side, and adolescent health is also at stake. Yeah. So at the moment, those are the challenges that I can point out.
All right. And oh, can you share with us the key demographic that that your project is engaging with, the key demographic?
In terms of the target audience,
Yes, in terms of the target audience.
Okay. So our adolescent and young people SRH programs are targeting adolescents and young people between the ages of 10 and 24. That is our main target group because they are the most affected group, given the condition that during this particular phase, between the ages of 10 and 24, that's when as an individual actually goes through some development or biological changes that predispose them to risky behaviors that can actually put their health at risk. So most of the time, if not all the time, our focus group is on adolescents and young people between the ages of 10 and 14. Yes,
All right.
and we are
And
based in Mombasa, most of the time.
Mombasa County. All right. And
Yes.
uh, tell us about the impact your projects have had so far.
Okay. I can say one of the impact is that through the school-based program that we are having on life skills, it has actually helped us gain the buy-in of a cross-section of schools here in Mombasa, where now we've seen different teachers actually coming to us, acknowledging the benefits that they've seen the life skill session having on their learners or on their students. So that is one good, I can say, a result that I can point out that other areas can actually also pick on because we actually depend on such kind of goodwill for our projects to be effective because if there's no community buy-in on any project, then its implementation actually becomes a problem. The other good result that I can say is that we've contributed immensely to Mombasa County in our project, which has run for the last 5 years. The one we were addressing teenage pregnancies, we've managed to make referrals to more than 1,200 adolescents and young people aged between 10 and 19 in terms of seeking services. And these services are in terms of sexual productive health services. And that is just in one ward alone because the facility is at Zualangombe ward in Nyali sub-county. The other result that I can point out is the one that I mentioned earlier, where now we had the Kilifi CC for Health actually making a commitment of 5.2 million in their supplementary budget that will go towards the refurbishment and operationalization of youth-friendly centers. And we've also been able to plug ourselves in various networks
All right.
and planning of SRH programs in Mombasa County.
All right. Seems there is a network issue. Can you
Okay,
hear
sorry.
me? Can you hear me, Gaitan?
Yes, yeah, I can get you
Yeah, you
clearly.
are you are kind of saying about the impact because you've said that you've reached 1,000.
Yeah, in Ziwalangombe ward, where our project was based, we've been able to reach almost more than 1,200 adolescents and young people aged between 10 and 19 years. And these ones are the ones we've documented that were able to access services and commodities at the facility that we are managing on your.
Oh, hello.
All
Can you hear
right.
me?
Yeah, it seems like there was a network issue.
Oh, okay. Yeah, I guess the network is scrambled on my side. But if
Ah,
there's maybe you didn't get anything, I'm very much willing
yeah,
and ready
you
to.
said that you reached 1,000 adolescents in a
Yeah,
certain ward.
yeah, more than 1,200 adolescents in Ziwalangombe ward.
Or
It's the
the
one
Walangombe
where
ward.
Yeah. It's in Nyali sub-county. That's where one of our projects was based, the one that was addressing teenage pregnancies in Mombasa. So the 1,200 adolescent girls actually refers to those who access services as well as information when in relation to sexual productive health and rights. And when you look at the records, actually, the facility did not have support initially. And that area, the ward, is one of the areas in Mombasa that also gets to record high teenage pregnancy. So having these numbers of young people accessing information and services is a good indication towards the reduction of teenage pregnancies. Yeah.
And is the health facility that where you're offering the youth-friendly center situated at that particular ward?
Yes. It's actually at the center of the community. It's a
Ah,
community facility.
all right. So maybe now you can ask Seif to join the studio, Seif Jira, so
Okay.
that
Thank you so much.
thank you so much for your contribution, Gaetano.
You're welcome, brother. And you look familiar by that. I think I've seen you a long
Yeah,
time.
we met. I think we met last year in Watamu during the
What
Reproductive
time?
Health Network. Yes, we met in Watamu.
Ah,
Yes, and then
okay.
I've been engaging with the stakeholders in Mombasa County, Kilifi County on matters health. I don't know whether you were at the Adolescent Health Symposium in Diani last year.
I was, I was supposed to be there, but something came up. I didn't attend.
Yeah, but me, I follow your work closely on Twitter.
Uh, oh, thank you so much. Thank you so much.
You're
Yes,
welcome. You're welcome.
yes.
Okay, here is safe now.
All right.
Hello.
Yes, safe.
Yes.
Yeah, so thank you for sharing information, and Gaetano has also provided comprehensive information regarding your projects. So right now, I'd like
Okay.
to ask you to take this a few minutes to pitch to a donor who is watching this show and
Am I
tell them
here?
why they should work with Dio.
To talk to the donor is that DIO is one of the youth-led organizations that gives service and also empowering young people within this country. And we have networks that rely on us. Apart from having the network, DIO is one of the organizations that has a vision that the vision is not only helping young people within Mombasa, but our vision is to make sure we reach each and every young person in this country.
Your line is breaking.
So I'm saying, hello, hello, are you getting me
Yes,
now?
yes. Kindly start again.
Yeah, I'm saying the organization has a potential of reaching many young people within this country, not only in Mombasa, but in Kenya in general. So, to me, my appeal to the donor is that if you want to partner with the DIO, it's simple. You just express your interest and say that I want to work with DIO and also implement program together. We are open to partnership. That is one. Two, if you want also to support our program, we can allow you to come and support any program. If you want to support a school-based program, we are ready to invite you to come and support. If you want to support the policy work that we are doing in terms of advocacy, we are ready to welcome you. If also you want to support administration costs for the personnel within DIO, you are welcome to come and support us. And we believe that working in partnership will help us to reach many young people, especially adolescents and young persons. Thank you.
All right. So thank you, viewer, for joining this discussion. Thank you, Seif Jira, for accepting the invite to come and share with us and with the world the work that you are doing with regard to matters adolescent and youth sexual reproductive health. So thank you for joining us. So, viewer, I take this opportunity to thank you for your time, and see you on Wednesday. We are going to feature a remarkable lady from Burundi, who's going to share with us the work that they are doing with regard to adolescent and youth sexual reproductive health. All right. See you on Wednesday at 3 p.m.